Okay. All right. Well, are we pretty? Thank you. I think we're pretty much ready to get started. I don't want to wait too much after 4 o'clock because we have a lot to cover. And yet at the same time, I know some of our task force members are confirmed, but maybe got stuck in traffic or what have you. But, you know, we'll just kind of plug along, and when they get here, they get here. Betsy, we don't have a city clerk, do we, for things such as roll call? Should I do that myself? Okay, sounds good. In fact, Mayor Edwards, no, none of this, sir. Mary Ann Edwards is the mayor for Temecula for 2014. Would you be kind enough to just keep track as I read the names of?
I will be your scribe, yes.
Thank you. Okay.
I haven't done that since Girl Scouts, but I can do it.
Thank you. So we'll call this meeting of the Regional Family, Youth, and Health Task Force to order. We'll wait till, is that Mr. Rodriguez? Yes, Julio. We'll wait for Julio to get here.
I'm looking for a pen.
Okay, take your time.
I didn't know I was going to be called upon.
Hey, Julio.
Okay, I found gum if anybody
All
wants
right.
that. I have it.
Okay. All right, here we go. So, Happy New Year, everybody. Let's take roll. Mary Ann Edwards, Mayor, City of Temecula.
Here.
Mike Nagar, Council Member, City of Temecula. I am present. Alan Long, Mayor of Murrieta. No. Okay, Rick Gibbs.
Here.
Tim Brown, Mayor Pro Tem, Canyon Lake. Mary Creighton, Council Member, Canyon Lake.
Here.
Shelley Milne, Mayor Pro Tem, City of Hemet. Okay. Robert Youssef, Council Member, City of Hemet. Ross of Valenzuela, Board Vice President, Hemet Unified School District. All right. Natasha Johnson, Mayor, City of Lake Elsinore. She couldn't make it. Steve Manos, Mayor Pro Tem, City of Lake Elsinore. Here. Howdy, Steve. Tom Thomas, Board Member, Lake Elsinore Unified School District. Jerry Bowman, Board Member, Menifee Union School District.
Here.
Jerry. Chris Tomasian, Board Member, Murrieta Valley Unified School District. She said she couldn't make it. Rita Rogers, Mayor Pro Tem, City of Paris. She called at the last minute, said she couldn't make it. Julio Rodriguez, Council Member, City of Paris.
I'm right here.
Hi there. Bill Holstrom, Board President, Paris Union High School District. Here. Crystal Ruiz, Mayor Pro Tem, City of San Jacinto.
Here.
Hi. Mark Bartel, Council Member, City of San Jacinto. John Norman, Board President, San Jacinto Unified School District. Here. Great. Vince O'Neill, Board President, Temecula Valley Unified School District. Nope. No, I don't think anybody's filling in for him. Michael Vargas, I know, is here, Board President, Val Verde Unified School District.
Here.
Howdy, howdy. Benoit, Mayor Pro Tem, City of Wildemar. He's not here, okay. All right. And Bridget Moore.
Here.
Councilmember, City of Wildemar. I'm sure some, like I said, people will come strolling in. Well, just want to welcome everybody. This is our last task force meeting. It's our 5th meeting. You know, we've learned a whole lot, and I think we've come a long way, and we're going to recap this at the end of our agenda and see where we go from here. We had one of our board members, Trustee Michael Vargas, wanted to play a video before we got started, so I'm going to go ahead and ask that get queued up, and let's see that video. And it's apropos to our topic today.
Can I give a few words before we get started on that?
Absolutely.
The video you're about to see is from Teen Vision. Teen Vision is a student-operated broadcast and production program from the Valverde High School in Paris. Teen Vision is students have also created numerous commercials for such businesses as Juice It Up, AGS Martial Arts School, and our very own Valverde Graphics Department, as well as numerous public service announcements for our local cable channel. For 13 consecutive years, Teen Vision movies have won prestigious awards from Panasonic, KWN program. Mr. Del Campo, an instructor with Teen Vision, and several students have gone to New York to receive their awards. In 2003, 11, and 2012, Mr. Del Campo and his team won the Best Video of the Year from Panasonic and represented Panasonic USA in global competition. In 2011, they won Global Best Video. Mr. Del Campo and his students have gone to Japan, Brazil, London for awards won for their short films. They have also received awards from the Student Multimedia and Media Film Festival of California and the Tituri Film Festival, Palm Springs Student Film Festival, and the International Student Film Festival, and they've also won prestigious Cine Golden Eagle Award. I had to give them accolades because our Teen Vision is doing an outstanding job, and as the video you're about to see is a classic example of what they're putting on, and this is about teen substance abuse, which is right on target with today's topic. And then, at the end, for those who are here, I have complimentary copies of the DVD for all members from each of our agencies.
You've isolated everyone. You're doing too many drugs, man.
You're addicted, Tommy. Please get some help.
Dude, you don't even know what's real and what's not anymore. Your reality is all messed up.
I don't have a problem. I can handle it.
Listen, Tommy, you need drug counseling.
The drugs are making you lose your mind.
Thanks for sharing. How about you, Tommy? Why don't you share with us your story?
All right. Hey guys, I'm Tommy. Kind of new at this, but all I can say is I'm happy to be off drugs now. But when I did drugs, best way to explain it, mine just felt like an old abandoned house. I was alive, but really I wasn't. Once I stepped foot inside this abandoned house, I soon realized I couldn't get out. For inside the house, I met this creature that befriended me. At first, I enjoyed its presence, but slowly it started to turn and consume my life. I soon realized its true intentions. It wasn't a friend, but a monster of addiction. I wanted to leave this place, but the monster was always there, waiting and waiting for me.
Where are you going? You can run, but you will never get away.
Please, just get me out of here!
Need me.
No! I just want out!
There's only pain out there for you.
I don't need the drugs anymore.
I'm glad I got away from that house, away from that monster. I'm clean. I haven't used drugs for a few months now.
I know quite well how hard it is to get off drugs, Tom.
Kind of sounds like you don't believe me, Mr. White.
Please continue, Tommy.
Doing drugs made me forget about the pain. And of course, that's what the monster wanted me to believe.
You ran away from home when your mother needed you the most.
What a shame, Tommy. You weren't even there when your mother died.
But I can't see my mom this way, Carl.
You were an ungrateful, worthless son to her!
Your mother died that night, did she? And you were never, were you? What kind of son would leave his mother while she was dying?
I was only 15 at the time.
Now you carry the pain. I can take away all your pain.
It's hard to explain, but the monster made me feel like drugs were my only hope.
So, you say you're off drugs, but don't you still hang out with friends who still use them?
Yeah? I mean, I'm not like them anymore. I'm stronger.
Really? You're stronger?
My world was falling apart. I was alone. My mom died. I needed friends, so I did drugs with them. It's not my fault.
It's not your fault. No one put a gun to your head, did they? Tommy, it was your choice to do drugs. In fact, I think you like the monster.
What? Why are you saying that?
Tommy, you're still using drugs, aren't you?
I don't use drugs anymore. I told you. I'm not using them anymore. What's happening? What's going on here?
And you thought that you could
Escape from me. You want, but you will never get away.
I don't need the drugs anymore.
Remember, Tommy, you chose me.
Current studies show that people who start using drugs at an early age are more likely to trigger an addiction that can last a lifetime. So please, don't let drugs destroy your life. Get help.
That was amazing.
Thank you.
What motivated them to do that?
Well, you know, every year they've been producing quite a bit of different short film videos, and it was just that year they selected to do the substance abuse. Valverde High School is actually a continuation high school, so unfortunately, we have quite a few kids there that are there because of substance abuse already, and or anger issues or what have you, or just don't want to study. So I believe that was probably the inspiration of the student, whoever came up with the idea.
Would it be inspirational to them to have a proclamation of some sort from this group
Absolutely.
acknowledging the impact and the power of what they did?
That would be really nice,
Would-
yes.
And if that would, I would assume there's a consensus to do something like that. On behalf, Betsy, could you see that that's taken care of on behalf of everybody? Tell them we're extremely proud of the work that they did.
Thank you, I will.
Thank you. Right. We'll go to item 2 on the agenda, presentation of substance abuse and youth. Our guest speaker, Rocky Hill. Rocky, why don't you come on up, and you have the microphone, sir.
Thank you, sir. Good to see you, Mike.
And you too, Rocky.
That was a wonderful presentation. Thank you for sharing that.
Absolutely.
I don't know which way to turn. I guess I'll face this way. You know, what those young people, I think, were trying to express is that you know, it's so easy to walk into addiction, and it is so hard to get out. And, you know, very often it's incarceration or death that ends up being the end result, that or recovery. So what I'd like to do today, I started out and I had lots and lots of statistics to give you, and I was just going to read you statistics about how things had changed in the addiction treatment field or world. And fortunately, Melissa, I shared it with her, and she said, well, you know, she emailed me back. And she said, it's kind of lacks the heart. And that's it. What I want to do is share with you what it feels like, what addiction does to the inside, what it does to families. In the process of that, I may cry. So if I do, please, you don't need to jump up and rescue me. I'll be okay. I'll get it back together again. I have a tough time crying and talking, so if I suddenly stop, I'm not having a seizure. I'm just crying. So that's one of the things that, as a youth growing up, I was raised in a family where my dad was a fighter pilot, and I played football, things like that, and that was one of the rules. You don't cry, you don't let anybody see you being afraid, you don't feel. Everything's okay. My nickname at my fraternity in college was Cocky Rocky. And I used to wonder, why would they think that? Because what I experienced was this sense that I wasn't good enough, and this sense that of timidity almost, and yet what I projected to the world was exactly the opposite. And of course, when I was drinking, I was 6'5", 6'6", depending on how much I drank, and could dance and all kinds of things. But when I wasn't real good at that. My wife and I opened up our treatment program across the street here, so this is kind of like coming back home in the neighborhood. We opened up across at the Swing Inn in January of 1986, and I don't think, I had a number of people tell me, there aren't enough alcoholics in Temecula for you to be able to stay in business. Well, we proved them wrong. We're still here, and there are a lot of other providers and good quality treatment programs, and so I think there was an effort on the part of a lot of people to deny that there was any kind of a drug problem in Temecula. This was unique. Temecula was a place you came to get away from all those bad things. And so there was a vested interest in that. And that's part of denial. And we're going to talk about denial. And that's community denial. And it certainly affects individuals. I lived it for 14 years while I did the research and development phase of my studies of alcohol and drug addiction. I graduated from Oklahoma State with a degree in psychology and went to work as a juvenile parole officer. And the whole time I was injecting drugs into my system and getting drunk and doing all the kinds of things that addicts do, selling drugs, all that kind of stuff. So if there's time for questions, I want you to feel free to ask any questions about that. In 1980, I was fortunate enough to have someone who was able to confront me in a way that I could hear, and he basically said, "You're fired. If you go to treatment, you can get your job back." I went home and ended up finally in treatment at Desert Hospital, and that was the beginning of a new life. And I was able to go back, get my master's degree, meet my wife a year and a half later, and then have my daughter. This is Erin, my daughter. She works with us and does a fantastic job. And she didn't become an alcoholic, which is, we were absolutely convinced that statistically she had no chance. And I want to also introduce Allie. She helped me with the IT part of this. I'm not very technologically savvy. So what I'm going to try to do is give you the feel of addiction. There's going to be some informational parts of that, but I want you to get a sense of what this is about. We have had a sea change in terms of the types of drugs being abused anymore. And we'll go into that a little bit. Let me, there we go. This just gives you a little bit of an idea. A few years ago, 1988, I believe, quite a few years ago, Perry Peters with the Chamber of Commerce had received a $15,000 United Way grant. And a whole bunch of community leaders got together, and we sat down at the Chamber of Commerce, and we wrote down, we just brainstormed all the different problems: child abuse, domestic violence, traffic accidents, everything that we could think of that was a problem. Where are we going to spend this $15,000? And as we looked at all those problems, and there were probably 15, 20 problems, we found that there was one commonality, one common denominator, and that is that alcohol or drugs were involved in every single one of those. So the determination was we were going to spend that money on trying to somehow create a nucleus of people who could impact the community in some positive ways. We identified the school district, and for various reasons it didn't happen, but we were able to acquire 30, I believe it was, professional and resident spots at Betty Ford Center, and we sent a number of leaders, one of them in the audience. And I don't know if we sent a number of the city council members back then, Carl Lindemans and some names from history. What I wanted to do was to get a group of people who could understand that addiction didn't make sense. So we're not going to be able to create an answer that makes sense, that follows logic. So, because it doesn't make sense that someone who knows that this is going to be a problem and create pain for them, that they would continue to do that. And yet, for years, there were programs in schools. We spent millions of dollars on Here's Looking at You 2000. Well, that was a long time ago. Quest. There were all these different programs. This is going to be the new program. This is going to allow students to understand, kids to understand addiction. And then they're going to choose out. Given enough information, they'll choose out. If that were the truth, we wouldn't have problems with doctors, nurses, addiction counselors, juvenile parole officers, people who know that this is a problem or could cause me problems going into using alcohol and drugs. So, whoops. Anybody have any idea how you define addiction? How would you define an alcoholic? Yeah. Oh, you're cheating. No, you. Go ahead. Okay, doing the same thing over and over again. And expecting a different result. Very good. Okay. The one thing I would add would be that it's painful. That thing that you keep doing over and over again is causing pain. So, yes.
And also exhibiting multiple dysfunction in multiple areas of their lives.
Very good. So, life function problems. So when we look at what defines addiction, obviously there has to be the use of the substance. Somehow you get it into your system. Doesn't matter whether you snort it, smoke it, drink it, inject it. It's used, and sometimes, not every time, but sometimes there's a problem that creates some degree of pain for the individual, for their family, in some area of life functioning. Legal, work, school, health, finances, family. And then at some point in time again, and this could be spread out over weeks or even months, we return to the same behavior again. So the definition or diagnosis of addiction has nothing to do with frequency or quantity, those kinds of things. It has to do with the insanity of going back to something that caused you pain. That's an abnormal response to pain. So whether we want to put food, sex, or any other substance up there, that ultimately is the definition of addiction, is continuing to do that. So then we have to ask ourselves, well, why would they do that? That's the question. And the answer is very simple. There's really only one reason, because it takes me from point A to point B. And people will tell you that, I hear alcoholics say, well, I like the way wine tastes. I love the taste of beer after a hot day. Well, do you have to drink 3 six-packs? So the bottom line is that my want, when I use that substance, is to go from some degree of discomfort bored, empty, lonely, scared, inadequate, some feeling state that I don't like to a feeling state that I do like. How many people in here like to dance? All the women. Okay. Well, I don't like to dance. I hate to dance. It's the longest 2 minutes that I can spend on the planet. Fortunately, my wife doesn't make me dance very much because she says it looks like I have gum on the bottom of my shoes. So I think I embarrass her, and so she doesn't require much. But for me, that was a horrible 2 minutes. And, as a kid, you have to dance. You have to go to the dance, and you do the deal, and, But all I needed to do, I found, was stick 4, 5, 6 shots of tequila into my system. And all of a sudden, boy, I was completely different. That's my hair going back. And now I'm all over the floor. I'm feeling good. I'm looking good. I can hear people going, wow, look at that guy dance. And, with one little change, I just went from point A to point B. So whatever the nature of point A is, it doesn't feel good, and point B feels good. And we learned that there's a transition that will take us there. And different drugs do that in different ways for different people. So one person will drink alcohol and say, oh, no more for me, I'm beginning to feel it, which didn't make any sense to me because I always liked sedative drugs. But if methamphetamine or cocaine were the only drugs on the planet, I don't know that I would have ever been a drug addict. I didn't like that feeling. I didn't like that racy brain. My brain's already too racy. I want it to slow down. And so, give me some alcohol. This will really date me, Quaaludes, those kinds of things. So that's what we want to do. We want to make that transition. So when we try to understand what prompts somebody to do drugs or alcohol, despite these negative consequences, it's very singular. So then if we're going to somehow help them change, then the issue is, how do we allow them to go from point A to point B without using substances? All right? Okay, another big thing that we hear about is denial, right? For the family, denial is, we'll go into another little slide here in a minute. We talked about denial in the community. It's very often based on shame or other issues. For the individual, for the alcoholic or addict, denial is based on one thing. It's based on the inability to get from point A to point B. And so I will do anything, say anything, to deny that substance is a problem. It's not the alcohol, it's that I didn't eat today. It's because of some other reason that I had that problem. It's my wife, it's this, it's that, something else. Come on, go baby. There we go, all right. So let's talk about denial, what it looks like. It's also affected by shame. Your father doesn't have a drinking problem, and don't you dare talk about it. And you'll see that in elementary school kids. It's really tough to sit down and talk to elementary school kids about alcohol and drug addiction. They don't have a frame of reference. But they'll tell you all about how the helicopter was at their house last night, or how mommy and daddy got into a big fight last night. By middle school, they're not telling you anything. By high school, not a word. Denial is also based on fear. How will I ever have fun again? How am I ever going to be able to enjoy myself again? How am I ever going to dance again? Cultural beliefs. I'm Irish. We drink. In my family, that's the way it was. My dad drank, I drank, my two grandfathers, one grandfather died of drinking Sterno. That's probably not the best way to go. Minimization. I only had two, officer. And then this is the one I really like. If you had a wife like mine, you'd drink too. And then there's the one, the LSD marijuana one. The guy that is too smart. And he's going to convince you that man has always sought to change their consciousness. And then justification. It's my reward after a hard day's work. So then the question becomes, how do we penetrate denial? How do you get through that denial? Whether it's in a treatment program or anywhere else. And ultimately get somebody into recovery. We talked about being able to give them some access to point B, but there's a process for this. And the first thing in that process is pain. We don't wake up in the morning and say, boy, my life's going really good. I think I'll go into the Betty Ford Center, or I'll go into treatment somewhere. I'll go to an AA meeting. We go in because there's some pain. It hurts. My wife's going to leave. I'm going to lose my job. I'm going to lose my freedom. Whatever it is. So when we buffer the individual from those natural consequences related to their use of substances, then what we do is enable them to continue that same behavior. We've got a name for that. That's called codependency. And efforts by someone else or some other entities to buffer the individual from the pain. Second thing that has to happen for that individual, after they have experienced pain, they've begun to consider that they need to make a difference, they've gotten perhaps into treatment, now they need to get some hope. Hope for what? Hope that there's a way to get from point A to point B without the use of drugs. That there's some possibility that I'm not going to be stuck the rest of my life over here in this emptiness, this sense of inadequacy, this loneliness, this sense that I'm a mistake. I've been doing this a long, long time. And the one absolute that I can tell you is that every person I have seen that has come through our treatment program has a disconnect between what they think and what they feel. And they can tell you all day about ideas, concepts, things like that. But ask them how they feel, and they can't tell you. When they're telling you about their dog, how their dog got run over that day, and you say, well, how do you feel about losing your dog? Well, I feel like I need to go kick that guy's butt that ran over the dog. He was speeding too much on our street. He always does that. I don't want to have to feel that grief, that sadness. And so when people come into treatment and we do an assessment, the very first thing I tell them is, this is going to be not about teaching you how not to drink or how not to use drugs, but how to be able to change the way you feel. Tail end of my drinking, after I'd been in treatment, I left, and 38 days, and I got a little medallion, and I'd been 10 days hooked up to IVs to get fluids back in my system. I had pancreatitis, gastritis, liver disease, or liver was enlarged, and I went straight to Thrifty's, bought a gallon of wine, and started drinking again. That doesn't make sense. That's not a rational, reasonable response. And I drank for 3 days, and I finally said, enough's enough. I don't want to do this anymore. I want out. And I put a gun in my mouth, and I sat there for about 3 hours back and forth, trying to work up the courage to pull the trigger. And I didn't particularly want to die, but I didn't want to live at point A the rest of my life either. Because once you've experienced being able to feel comfortable in your own skin, you don't want to go back. You don't want to. I could not imagine living the rest of my life without ever drinking again. That just seemed unfathomable to me. And when you point a gun at your brain, your own brain, there are a lot of people up there, at least in my brain, and they start coming forward with a lot of different ideas. Oh, just get it over with. Pull the trigger. Other thoughts were, well, you know, dead's a long time. And we finally, I say we because there were so many different people up there with opinions, we came up with the decision that what I was going to do was give recovery 6 months. And if in that 6 months I wasn't able to get to point B, then I was going to go rob a pharmacy, my first big crime, and I was going to get a bunch of good drugs, take those drugs, and then, when they caught me, kill myself. So what I got in that treatment program, even though it would appear that it didn't work, I got hope. Because I remember sitting at an AA meeting, and I'm not breaching anyone's confidentiality with this, he's very open about this, and I had that mindset that men don't cry. Real men don't cry. And I looked over and I see this guy and I think, I know this guy from somewhere. And he's just sobbing. And he's talking about the damage and pain that he's inflicted on his family. And I said, who is that? What's that guy's name? I said, oh, that's Buzz. That's Buzz Aldrin. Put his foot on the moon. Well, now that doesn't fit with not having any courage. It takes a lot of courage to get in a rocket ship, go to the moon, get out of a perfectly good rocket ship, and walk around. And nobody's ever done it before. And so what that did was challenge and create some dissonance in my brain. Men do cry. This guy's a man, and he cries. And so the process of recovery for me was a slow one, and I believe it's a slow one for anybody who ventures into the thing called recovery. Because you have to begin to look at ideas and attitudes that limit access to those normal, natural feelings that we all have. That part of me that really made me who I was. What I believed was not who I was. What I felt was who I was. And so fortunately, I was in that treatment program long enough to get some hope. So the trigger didn't get pulled, and you have to listen to me today. And so then the last thing that has to happen, or the next thing, and probably the last thing, is at some point you have to experience that change. You have to actually get from point A to point B. Because it's all fine and dandy to believe that it's possible. I can go to AA meetings and I can look around and see people that are in recovery and celebrate 5, 10, 15, 20 years of sobriety, and I can hear them talk about recovery and how the changes that have occurred in their lives and how they feel comfortable in their own skin. They made it to point B, but is it going to work for me? I don't know. And that was that leap of faith that I took when I decided that I'll give this 6 months. Won't check out now. I don't know if it was a leap of faith or if I was just afraid of dying. But I can recall distinctly the moment that I made that transition. And it wasn't any great, wonderful thing that occurred. I simply was driving down. My mom, I was living with my mother, which at 33 years of age is not every young man's dream. And she owned a motel in Palm Springs, and she had bought me an old beat-up Volkswagen. And I'm driving along Palm Canyon. I don't have any money. I'm making $3.33 an hour. So I don't have any of the things that I think are going to make me happy. And I had a sense of completeness and wholeness that was at least as good as point B ever was. That was the magic moment. I can remember that. I also remember the first time I got drunk on Tall Boy Colt 45s. And I became 6'6" and incredibly smart and good looking and, you know, big shoulders. And we were going to go chase girls around Clovis, New Mexico. I never made it to see any girls. I ended up behind a toilet vomiting on the floor. But I remembered that distinctly, that moment of feeling that state.
Rocky, as you proceed, I just want to give you a sense of time. We probably need you to wrap it up at the top of the hour, okay?
All right.
Just so you know.
Okay, no problem. We're going to move. So what I want to do is talk about what's happened. And used to be, when we opened here in 87, this is what we had. From 87 to 2004, methamphetamine, alcohol, marijuana, cocaine, pain pills, and heroin. In that order. Very rarely did we see somebody come in with heroin addiction. It was methamphetamine. We were supposedly the capital of methamphetamine, this area somewhere out here. I'm not sure where. And now what we see, 60% of the population is coming in addicted to heroin or pain pills. And the difference is methamphetamine makes you look like death warmed over. Heroin kills you. And so what we find is young people who get addicted to pain pills, OxyContin, Norco, Vicodin, and then the next thing you know, they can't get it because their doctor won't give it to them. And so what they do is they can switch. They can always get heroin. Heroin's everywhere. It's easily accessible. Every kid that comes in, every young adult tells, even older adults tell me, I can get heroin anywhere. It's cheaper than the OxyContin. Costs me more money. Opiates uniquely target the best and the brightest. We have also seen a complete difference in the patient that's coming in. We've had Eagle Scouts come in addicted to heroin, kids on full ride scholarships, athletics scholarships, a Major League Baseball player. It's a different type of person. Let me go back, make sure it wasn't something else there. There are just some statistics. Today, drug overdoses kill more than traffic collisions. Every 19 minutes, someone dies of a prescription overdose in this country. Prescription drugs overdoses claim 400 more lives than gunfire. In 31 states, overdose is the leading cause of death. Since 1990, drug overdose deaths in the U.S. have tripled. Heroin use is up 75% between 2007 and 2011. The U.S. has 6% of the world's population and consumes 90% of its opioids. Those are heroin and opiates of different types. Addiction does not happen in a vacuum. Addiction happens in families, mine, your neighbors, your best friends, your coworkers, your doctors, maybe even yours. Would you know it? What to do if your son or daughter begged you for help? I had a mother in my office yesterday begging her son. Who would you call? How would you know that was the right place to call? Imagine right now that your phone rang and someone said, your child is addicted to heroin. What would it feel like? It's happening all over our community right now. What can we do? There are medications. There's a study out of France in 1994. I'd encourage you to look it up. I've got some papers out there on Suboxone. We found it extremely effective. Recovery rates have gone up significantly. The study showed of 108 heroin addicts, 82% recovery rate. Harvard, Yale, and Johns Hopkins have done more recent studies and have found also very similar recovery rates. What I would like to encourage our leaders to do is to begin to recognize that this is a monumental problem. And if we were to have the true numbers right now of how many people are ending up in the emergency rooms addicted to opiates, and how many people were actually dying of opiate deaths, because what ends up happening very often is the coroner's report has a different result. They got hit on a bicycle, something like that, but they were under the influence of opiates. So hospitals need to know how to deal with it. Physicians, pharmacies. I would love to see a committee created that included those disciplines. Schools, drug testing, drug-free workplace campus, review or revise policies. Legal, I would love to see the drug courts come back. Drug courts are wonderful. They maximize changes in people's lives because addicts don't know anything but immediate consequences. It's the only thing they respond to. It's immediate, now. You get hooked up and you go now to jail if you're not testing clean and doing what you're supposed to be doing. Advanced education for child protective services and family courts, and the government ultimately accessing grants, initiate legislation, support change, assist coordination, and somehow bring this together into a fashion that we can do something meaningful. Right now, 50% of ER visits are alcohol or drug related. There's a system called CURES, and it's also referred to as PDMP, Prescription Drug Monitoring Programs. Physicians don't know how to use this, typically. I've asked a number of physicians, how do you access the CURES system? They don't know how to use it. But any physician can look up and see if somebody's doctor shopping, and they can find out it, because there are people out selling pharmaceutical drugs out on the streets. Where are they getting them from? From doctors, but maybe they've gotten them legitimately from doctors. And they've got people going around from place to place to place. They go to senior centers and buy up excess opiates. Hospital medical staff need to be trained in SBIRT, screening, brief intervention, referral, and that's part of SAMHSA. Encourage employers to create drug-free workplace. We now have parity so that the Affordable Care Act insurance will include a mandate there in the legislation for the insurance company to cover alcohol and drug addiction. That wasn't the case in the past. They could discriminate against that and did. That's no longer possible. So I'm going to leave it there. I've got a few more things here. I'd love to see a clean and sober school. I know I'm running out of time. Every area of our community can change. And I want to plead with you as leaders to recognize that we have people dying every day. And there are children in schools, 1 in 4 statistically have a parent at home that's chemically dependent. So I thank you for allowing me to come here and present, and I hope we can do something in the future. Thank you.
Rocky, thank you. Why don't you stay up there real quick, and let's see if any of the panel members have some quick questions for you, and we'll just, Mayor Edwards.
Thank you, Rocky. That was very sobering information, but very useful at the same time. We've heard about heroin in the last, 5, 6, 7 years especially, and incidents of people that we know whose children, and frankly, I know it happens. It's just beyond me how that can happen, but I know it does. And you mentioned this drug, Suboxone?
That's correct.
So enlighten me, because we've heard of methadone for years and years. Aren't those just other drugs that have the same effect as heroin but aren't as dangerous? Or enlighten me, what are those drugs?
Methadone, I'm sorry.
What are they?
Methadone is just long-acting heroin. That's all it is.
Well, then what's the difference?
The difference between methadone and Suboxone?
No, but I mean, why?
I'm not proposing methadone
Yeah,
as an
I
alternative.
okay.
We've never used methadone, and that's just my belief system. I don't believe methadone is a viable alternative. Suboxone is a partial agonist. It is in the narcotic family, but there's no way to get high off of Suboxone. There is a ceiling effect. That's why I brought the literature here from Stuart Gitlow, who's the president of the American Society for Addiction Medicine, and it talks about it a little bit more in detail than I'm going to be able to cover here. But there's a ceiling effect, and it also closes the receptor sites so that the person can't use heroin or any opiates. What it does for us is we don't expect that person to be on that the rest of their life. What we want is we want somebody that we can work with. If they're loaded, we can't work with them. And if they're in withdrawal, we can't work with them. If they're in withdrawal, brain's off thinking about, God, I feel so terrible. And withdrawal from opiates can go on and on and on. 18 months. I've had a woman in my office 18 months later and off of Norco, secondary to a knee operation.
So it limits the impact that the heroin can have.
Absolutely.
Okay.
And I could go into Aaron would kill me. I could go into detail about how it works. I'm not going to.
No, but I just...
But it works, and I can tell you that our recovery rates have gone from probably 5% to somewhere in the 80 percentile.
Wow.
So we've had a couple of pregnant mothers who've been able to detox utilizing the Suboxone, and one delivered twins, and the other one is due to deliver any day. So it is an extremely effective drug. The problem is people can't afford, we only have 6 or 7 doctors in the valley, maybe a few more, who are Suboxone certified. It's an 8-hour course. It's nothing, it's a safe drug. You can't overdose on it. It doesn't build tolerance. Doesn't matter how long you take it. Doesn't go up and doesn't take more later.
Well, then that begs another question. If we have so few doctors that are certified, why is that? Because if it only takes 8 hours.
Well, insurance companies don't want to pay for it for the office visit. There isn't a diagnostic code to bill under, so they have to charge, and they charge anywhere from $500 to $150 to be seen and to write the prescription. And then the patient has to come back in again each month and get the prescription refilled, and that goes anywhere from $80 to $120.
And then they have to take it.
They have to take it, absolutely. But our experience is that the people who have struggled with the withdrawal syndrome of every morning waking up, by the time they get to us, it's been a year that they've been struggling with this, whether it be pain pills or they've morphed to heroin. And they are tired of it. They are sick of it. It's like, I'm not even getting high anymore. I just don't want to get sick. And so when they're allowed to now feel normal, because it blocks the receptor site, it closes the receptor site. So now they're just normal. Within 45 minutes, they absolutely are normal. I will share this with you. I am on Suboxone right now. I had those football games, remember the over-the-hill pigskin shootout?
Yeah.
Well, I tore my rotator cuffs on both shoulders. My left shoulder never healed, so I had surgery. A month and a half after the surgery, I was in an automobile accident, and I tore everything out again. So the choice was, get on Norco, break up the scar tissue, or have a frozen shoulder. I thought, no problem, I can handle that. I've done it before. I'll just take it according to the doctor's dose. Didn't take it anymore, no problem. I got to the point of needing to come off. I couldn't get off. 45 days later, I'd lost 20 pounds and couldn't eat. I was drinking Ensure in the morning and at night. It was horrendous. I cannot describe how uncomfortable it was. I'm 65 years old. 9 years ago, I started on Suboxone. And that's when we began to use it was 9 years ago.
Wow.
And we've had a number of patients that have used it. And some, we don't care. I mean, if somebody wants to come off the old way, we're fine with that. But we want them to at least have an option and know that that is available. And I can assure you that, you know, all it has done in my life is enhance my life. I want to be able to go scuba diving. I want to ride my horses. I want to be able to live my life. And I don't want to have a shoulder. The secondary beauty to Suboxone is that for 0 to 6, it's a wonderful painkiller, analgesic. So science has come a long way, and we still have a bit further to go.
So it
thank you
stops
for
at the
that.
pain and doesn't go to your head and have the same impact.
There's absolutely no euphoria. You wouldn't know you took it, you know, unless you went 2 days and didn't take it, and then you'd go into withdrawal. However, the withdrawal typically is much less, in our experience.
Wow.
Any other questions?
Anybody else?
Yeah, kind of a two-part question. You talked about how kind of the basis for addictions in general are your feelings and getting from point A to point B. And so we're talking about substance abuse, and the first step is obviously getting off the substance. What are the differences between the treatments for substance abuse and other types of addictions?
Process addictions?
Like food or whatever, it might be gaming, whatever it might be.
Right.
And second, what supports need to be in place once they get off of the substances in order to make that transition?
Good question. I think that for process addictions, we're not worried about detox.
Right.
Okay? So with some of the drugs that we deal with, people can die in detox. If they're coming off benzodiazepines, they can go into status epilepticus, have seizure after seizure, and die. So that's a big difference in terms. But other than that, I don't think there are a lot of differences. I think that there needs to be that support on a psychodynamic level. We can't change the brain chemistry. Some things work for some people. I never could understand gambling addiction. I looked at people like that, and I could be very, you know, self-righteous and say, what, you're so weak, how could you do that? Just quit. But then people could look at me and say, why don't you just stop drinking? So it depends on what works for what person.
Right.
But I think process addictions are identical in terms of once you get past the issue of brain chemistry and
so
the withdrawal.
Treatments would be very similar.
I think treatment would be very similar.
What kind of supports need to be in place if you're a family member or whatever, because you don't want to enable.
And that's why the family needs to be included in the treatment process. So, for instance, in our program, every Monday night, the family members come in. Every Wednesday night, we have a free support group for anybody in the community that wants to come in, family members of people who are addicted to anything, to substances or process addictions. Doesn't make any difference. But that's an important element, that the family begin to heal and get well as well.
Thank you.
But thank you. Good questions.
Anyone else? Mike?
Just want to say thank you very much, Rocky. Great presentation, good stats too. And you're more than welcome to take a CD with you if it can make any use for you.
Very good. Thank you so much.
Thank
I
you.
appreciate that.
Anybody else? Yes. Julio. And then
You briefly mentioned the drug courts. I think we're talking a lot about treatment right now. Again, I'm sorry for not thanking you first. So thank you, Rocky, for being here today. My question is, what were the drug courts then that you were talking about? And since this is a policy-making body, what can we do to discuss the over-incarceration, especially of youth, when it comes to being in possession, being under the influence, when hopefully it was clear to my colleagues to the left that it's a disease and that treatment like this sometimes is the alternative. Is that what the drug courts were doing back then?
Yes, they were. I think that the drug courts, if you can envision this as a court right now, the judge would be sitting up where Mike is, and each person, the whole group of people that are in the drug court are in the audience, and they bring each person up individually, and the bailiff stands behind them. And the judge reviews their record, because the treatment program people are there, and they have all their drug test results, and Mike may say as judge, well, Sally, you've done really well. That's great. You know, you're going to meetings. Your drug tests have all been negative. That's wonderful. You know, congratulations. And everybody in the audience applauds. All the other people who are addicted and part of the drug court program. And then Joe gets up, and Mike says, well, now, Joe, we've got a problem here. You got 3 drug tests on these dates, and they're telling me you're not going to AA meetings and you don't have a sponsor. And, you know, I don't understand. What's the deal? Well, those drug tests are, you know, blah, 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 whatever excuse. And so Mike, as judge, would say, well, you know, my experience is that works. Bailiff, would you go ahead and take Joe into custody, and let's go ahead and incarcerate him. So Joe goes off, and drug court is immediate. And they come in every week, and they're in treatment. And so you're taking that pain, forcing them into an arena where they begin to get hope, even though they don't want to be there, and it starts to work. Something starts to happen. Drug courts have tremendous results. They just ran out of money in most cases. The Vista courts I was very familiar with, and they did an excellent job, and I believe we had a drug court here for a while. Your first question was relative to incarcerations. For possession.
It's been in the news, especially in this region, where we've been finding that they're selling drugs in the schools. And my concern was that instead of addressing the issue of how are these kids getting to the point where they're starting to sell drugs, because they didn't begin by selling drugs, they're probably using it to pay for their habit.
Right.
I mean, you as a professional and doing that kind of work in our community, recommend so that it doesn't have to get to that point, so that we don't get to the point where we have to do all these undercover stings. And we're done with that. And so because it's like you were saying, it doesn't make any sense that they would be doing drugs, especially when they're at school. You know, might as well not go to school and get high. And I think that's something that a lot of us who are coming from a privileged place don't understand what's happening and how to do something about it. And so what would be your...
Well, I think you're absolutely correct that for every drug addict, you're creating someone else who's going to be selling drugs. That's just, you know, that's the nature of the beast. It isn't the guy in the trench coat outside school. It's the brother, sister, fellow student, that kind of thing. And the reality is that schools need to have more revenue, and they need to be better prepared. There are individuals here in the audience who have been involved with student assistance programs. It's modeled on employee assistance programs, which have been in large businesses for years. Student assistance programs are very, very effective. They can identify students at risk early and begin to get them some help and their family some help. Again, probation officers. You know, we've had quite a bit of interaction with probation. They've been very open to us coming in and educating and helping. But unfortunately, very often there are no resources available to get that young person into treatment. There are wonderful programs like MFI, Whiteside Manor, Cedar House, but they're usually booked. It's very difficult to get somebody in there, and very few adolescent programs. So I think increased access to treatment.
That's problem. It's always money, isn't it? But thank you, Rocky. I just wanted to talk about really briefly about a friend of mine, and he was a UCLA graduate, was recreationally using in college, and then finally one day he got arrested, and the judge gave him a chance of 1 year, and it was really hard for him, and then finally makes it that year, but then he couldn't get a job because he still had that felony possession. Right. And it was his struggle was like, I just want to be happy, and it's so hard to be happy without having a job. And I think that's another way for us to think about it, that's why they go back. That's why they're always under the influence when they're in probation, because they can't get jobs. And this was just my friend's experience. I won't say that it's everybody's, but he struggled. And, you know, again, he was privileged. His parents were able to get him a lawyer. His parents were able to help him out in that sense, keep him at home. And finally now he's working with a nonprofit organization in LA doing that advocacy work in support of trying to help out with people who are having addiction. So just something for all of us to think about, that sometimes jails are not the answer when it comes to somebody being in possession or under the influence. And let's really think about, instead of investing the money elsewhere. We should invest it in treatment programs with professionals who understand this a little different than the rest of us. Thank you. Thank you, Rocky.
That's a good point. One of my best friends in my fraternity died this week from alcohol, the effects of alcohol. And we had offered to put him through treatment for free if he would just come out here and do that. So this is a disease that takes people's lives.
Thank you. I think. Yep, go ahead and press your button there. And, no, it's on the.
Oh, got it. Thank you.
Go.
A couple of questions. First question is, are you finding that obviously people who are doctor shopping with more than one doctor prescribing pain medicine is a problem, but are you finding instances where single doctors are prescribing pain medication and creating people that wind up coming to you where the...
Some, but not as much. I would say that was a problem, more of a problem through 2004 to 2009.
So
I think DEA has really cracked down.
So in general, the physicians are doing their job of not overprescribing, in your opinion, around here?
For the most part, yes, I believe so.
Okay, next question. With the current liberalization of marijuana laws all over the country, what do you think? Do you have a take on marijuana and how it might affect more serious drug problems around here?
I don't think there's I hear of marijuana being a gateway drug. We ask every patient that comes into treatment with us, what was the first drug you started with? And it's typically alcohol. It could be marijuana, but that just means those are the ones that are the easiest to access for them, marijuana and alcohol. I don't believe marijuana is a gateway drug. I think for people who have a legitimate need for marijuana, medical need, I think that unfortunately it's been misused and misprescribed, but that there are people who are very sick and we're giving them incredibly powerful drugs like fentanyl and Dilaudid and Demerol and morphine sulfate, but we're not going to give them marijuana so they can eat. That doesn't make sense to me.
Anybody else? Yeah, Steve.
You advocated legislation as part of one of the 4 major cross-sections of solutions on your slideshow. What would be your choice, top 3 maybe, legislation that we could either pass at the local level or things we can advocate for at the state or national level?
Wow, that's a tough one.
Giving you the magic wand.
Even the top one. I don't even think you need to pass legislation. I think having doctors having access to that cure system would be an enormous advantage. Physicians just don't know how to use it. And it would be very simple, seemingly, to take that system and make sure that every physician in our community, our region, knows how to use that system. Legislatively,
You can email me later if you'd like.
Yeah, I know when I sat down with this, I had hundreds of ideas about things that needed to happen. One of the big things that has happened is parity. And the parity, Kennedy-Wellstone parity law is in the process of changing the insurance industry. And it's allowing us to be able to treat people that we couldn't treat before. Okay. So that's enormous. That I think that probably, if I had a wish, it would be that there was more funding for places like Whiteside Manor, MFI, so that they could hire more staff to do what they do, and we wouldn't have to turn anybody away from treatment. If you tell an addict, come back, call for 6 weeks, they're not going to be there, typically, unless they are extremely motivated. No. Usually they're just going to go back. So I would love to see the revenue that was created or relegated to the places that need it, and that, in fact, that they get the monies that they need to do the job that they do well.
I got another question for you. How often do you see in your experience that drug, alcohol use is self-medication for psychological issues maybe, or physical pain?
For physical pain or just self-medication in general?
Either one. You're the expert.
I think it is almost always self-medication. I think as a kid public speaking was my biggest fear in the world, is my biggest fear in the world. I forced myself through it, but it is my biggest fear. I think I've had a panic disorder since I was a little kid. I remember having panic attacks when I was 8 years old. Why did I gravitate to sedative drugs, drugs that slow me down? I think that central nervous system was turned up. That amplifier in my body was turned up in my brain. And what I wanted to do was turn it down. And that would normalize it. So in a way, that's self-medication. Does every alcoholic or addict have some kind of psychiatric condition, diagnosable psychiatric condition? I don't know about that. But I think, what we see again and again and again is ADD, ADHD, bipolar disorder. Very often there's a secondary diagnosis that goes with it as well. So,
excellent.
And both needs to be treated. So,
thank you, Rocky. I appreciate it.
thank you.
Anybody else?
Thank you guys very, very much. I appreciate it.
I will leave you with thank you for being here, Rocky. I will leave you with this. You mentioned the Buzz Aldrin story, and if you have a Kindle, I encourage you to get it for $5. It delivers. The first 3 chapters are detailed on the moon landing, okay, and how it occurred. I mean detailed, and he delivers in that biography, but he spends about 7 chapters talking about how somebody who was so high, literally, walking on the moon, fell so low. And very few people have that idea. And he really gets into the issue of substance abuse and his alcoholism and all. It's a fascinating read. So I download it. It's worth the $5, trust me on that one. Rocky,
I'll get it.
Please do. Please do. And let me know what you think.
I will.
Thank you for being here. I encourage you to stay for the rest of the meeting. You never know what might come up, and you may be a go-to guy for some questions again, okay?
Very good. Thank you so much.
Sounds good. Thank you. Well, I want to move to item 3, final regional task force meeting recap. And I thought that there's probably no one better than our facilitator, Melissa Donaldson, to do that. So, Melissa, why don't you come on up and take us on a little journey of how we started, what we did, and where do we want to wind up, okay?
I will do that fairly quickly. And I have no technological skills, so Betsy's going to be my...
Yeah, and I've gone down here too.
Just click, she says. Sounds so easy, huh? Okay. Well, we're done. We've gone through all our subjects, and I know they were all heavy subjects, and I know it was a lot to hear, and we did it over a 9-month period, I believe. So in April, we had virtual gaming addictions by Dr. Doan, who's here. And in June, we did youth and violence, and I presented on that subject. July, we did social media and cyber safety by Wayne Sakamoto at Marietta Unified School District. We had human trafficking from our guest from San Diego, Gabriela Beza. And we just heard Rocky talk about substance abuse. And what I wanted to do, what I thought would be helpful, is just do a quick summation of what we learned and really give some ideas of where we can go from this group, if the group chooses to do that, in your respective cities and school districts, hopefully together, and make a plan to try and deal with all these issues. The first one, what we learned that video gaming addiction, frankly, is there. I knew it was there, and I'm a professional in the community, but I didn't really understand to what length that it is there. And I think Rocky also pointed out that gaming addiction is an addiction and needs to be dealt with, just like what we were talking about with drugs and alcohol. And what's interesting about that is June Early's here, who's the director of SAFE's Client Services. Right after, I believe, Dr. Doan presented, we had a case of a young man who was addicted to video gaming and became violent. He is now doing better, and he's learning to ride horses, whether he liked it or not, and everybody's doing much, much better than sitting at home in front of a video game, right? So it's really heightened me as a professional and what our work is to even start looking at those kids, and we have subsequently had other cases since then. So we do know that that is a real issue, and I thank Dr. Doan for bringing that to our attention. Then, as you know, I spoke about youth and violence, and 1 in 3 young girls experience teen dating violence, 1 in 5 adult men, and 1 in 3 women. So we know that family violence is an epidemic, and I hope I conveyed that to you all here. And that we know more women are killed and injured by domestic violence than cancer and car accidents combined. So if that doesn't give you a good look at how bad and how frequent that is, and remember I discussed what that does to the child that's raised in that environment, what do? They self-medicate, they start acting up, and it brings in all the other issues that are all tied together from having a home environment where you're exposed to violence. Social media, I think we all have been hearing about it. I think Wayne did a really good job of explaining to us really how dangerous social media is, and it also tied into our other presentation, if you recall, about human trafficking. So that's a venue. Social media is one of the tools that kids and perpetrators use to get young people involved in human trafficking. That's how they sell their drugs. That's how they hook up and do a lot of the at-risk behavior that we've been talking about. So again, that is our thinking behind putting these groups together. And of course, the last one we had was drug and alcohol abuse. And obviously, I think Rocky did an excellent job of letting you all know how pervasive this issue is. And he also, I believe, Julio, you touched on the undercover sting things that are happening by law enforcement to get the drug dealers off the school sites. It was so interesting to me when that happened because so many people were upset about that. And frankly, I was happy about it. We need drug dealers out of the school system. We need them out. We need schools to be the safe place for kids to go to. And if we don't do that portion of it, we really need that to happen. And do I think jail's the place for kids that are struggling with drug addiction? Absolutely not. But if we don't pull all these issues together and look at the beginning of why these issues are happening, because they're all tied together. The kids that are being affected and are engaging or living in homes that are not doing well, that have family violence, that have alcoholic parents, that have all these different things happening, these are the kids that turn out, and that's why we're looking at these subjects. Because these kids are affecting everything that happens. And I didn't press my button, Betsy, sorry. Okay. It's overwhelming, and what the heck are we gonna do, right? If you sit and, I don't know about you guys, I do this for a living, but to sit here and listen to this whole time, and if I was in your seat, I'd be going, oh my gosh, how do we do, and what are our next steps? What can we do? The problems they're overwhelming at times. We have no money. We don't know how to start. We don't know who to help. We don't even know who to call to get help. Well, I think my whole philosophy and how I've done my job my whole life is to start simple. And I think we tend to make things overly complicated, and collaborations are hard. So there's a lot of things you can do as community leaders, a lot, and you've already done them by participating in this task force. I think that's the first step. You showed your interest, you're here, and you're listening to some pretty heavy subjects, and all the subjects are affecting every single person in this room and your jurisdictions of which you have responsibility to oversee. So in a very simple manner, there's some different things you can do. You can do a very elaborate community assessment, or you can do a very simple start to do that, and that's whatever is gonna work for each group is different. My suggestion is to call together a small group of invested community stakeholders and leaders who want to collaboratively work together. And you see, I highlighted collaboratively. That doesn't mean you want people that want to get together because they're supposed to be there. I'm talking about people that want to have rubber hits the road work, boots on the ground, that want to talk about what the issues are, presenting in your community. You all represent 8 different cities and 8 different school districts. And it's different everywhere. But what affects Paris and what affects Wildemar affects Temecula and Murrieta. Because our families are transit, they move. Just because they live in Temecula today doesn't mean they're not going to live someplace else, that they're not going to live in Canyon Lake in a month. So the investment of all of us doing something makes sense for everybody in Southwest Riverside County. There's some really simple steps to do by pulling those people together. Get your statistics that for your area. This is a very simple thing, and it's all available to you. You have the ability to call the police chiefs and call different people in positions and say, I need this information. Get your stats. Just because we talked about these issues doesn't mean those are the presenting issues in your area. Drugs might be the highest area for one community and maybe be third on the rung someplace else. So what I would do is get an evaluation over the top first and gather data. Schools have their healthy student. I always get this wrong, but you know the survey they do with all the kids? That is full of information of what's going on with the kids. It's full of it. And the problem is we operate in silos. This person does this in this entity, these people do this over here, nonprofits work over here. And until we learn to pull everybody together and look at that data together and evaluate what that data means, how are we going to have effective solutions? What we end up having is the school districts do this, the nonprofits do this, the cities do this, and sometimes it's the same thing, which is good. We're all doing stuff, right? But if we leverage those resources together, I think we would be much better off. So start off with gathering your stats and getting people together that want to have the conversation. And my next one says what not to do first. And let me tell you why I say, please, gosh, don't bring up the first thing of money. We all know there's not enough money. Don't we all know that? I mean, I've been doing this for almost 30 years. We've been saying it for 30 years. There is money. The problem is we don't want to give the money up that we have. And when you pull all these people together, and because I'm a nonprofit, I don't work for the cities, and I don't work for school districts, and I don't work for the DA's office, but I'm usually, right now, I'll give you a good example. I'm the president of Family Justice Center Foundation. We pulled together a collaborative about 8 years ago of cops, attorneys, I'm trying to think some other, and I love them all, but they're all a challenge, nonprofits who whine all the time that there's no money, all sorts of people. Then we all come to the table with our own baggage, right? We wanted to do a co-located services for domestic violence, and that means everybody comes to the table, and we want to build it. And what do you think the first thing that came up was when we said that?
Where's the money going to come from?
Who's going to pay for it?
Yeah.
So what happens? People start jockeying for position. I'm not going to pay for it. I'm not going to pay for it. But you want the place, right? So what did Grover Trask do? And he's my hero, I have to tell you, the sitting district attorney at the time. He said, I don't care. We all need to come to the table, and he made us all say, we're going to play whether we have money or not. Melissa, you're going to commit a person. I don't care how you get the money. Don't want to hear about it. It's not an issue. Are you going to commit a staff person to me? And I said, yes, I'm going to commit a staff person to you. And we all did that. And then the second thing that always is a deal breaker, and school districts know this, confidentiality.
That's the hardest one.
So people throw in, I have no money, and confidentiality, because those are deal breakers, right? So what happens? People throw their, oh, we can't deal with confidentiality. I had so many attorneys and cops that said that, and you know what we did? We said, too bad, we're going to work it out. And we did. We have 3 family justice centers in Riverside County, and we've worked out the no money thing. We've worked out the confidentiality because you had people that said, we're going to do it. And that's what you need. So don't talk about money. I even say, when we build services, I don't say, oh my gosh, I think I'm going to go look for money to do this. Then I find the money, then I do it. I do it exactly opposite. I say, I want this kind of program. I build it, and then I go look for it. And then I try to figure out who am I going to play with? Who are my partners? Who are we going to collaborate with that will help me get that money? If you bring up we don't have any money, it's because you don't want to do it. That's my opinion. But I have the mic, so I get to do that, right? So back to community assessments. I really feel like from this group and from what you've learned, you have a basis to be able to go back and say these are the presenting issues. The reason we chose those subject matters is because we knew they were pretty heavy and pretty common subjects that are affecting our young people. And if they affect our young people, they grow up and it becomes the adults, and we have that whole repetitive cycle, as you well know. So my suggestion is that you go back, find 2 or 3 people that you really think are invested in fixing some of the issues in your own community, and have a conversation and start your work. Now, you can do it very, very different ways. You can hire a consultant. Yes, they're expensive, but if you really want to do it, you'll find the money. Or you find somebody that's really wants to do it in your community, and there's tons of tools on the web. They have Community Assessment 101. There's no excuse not to do it. And some are very elaborate and some are very simple. So you have plenty of options to look how to do that. I would also encourage you that when you look at doing a community assessment or even pulling a group together, that it's so easy to talk about what's not going well and how bad things are. I would also hope that you would stop and identify your strengths and all the assets that you have. Because sometimes there are players that you might not think about or might not know that can be very helpful to what you're going to do. And if you don't have a service or a provider in your area, you've met a lot of people through this task force. Give us a call. We'll be happy to help you. I would also encourage you to establish a simple mission statement and articulate your core values at the very, very beginning. Because what happens is, many times with task force and coalitions, and I've been on lots of them, I've been on national down to many with the city of Temecula and Murrieta, is that you start off with a good core group and a mission, and then as you bring more people in, agendas start changing, egos start getting into it, and all of a sudden you're off, and then 2 years later you go, I don't even know what I did. Everybody's shaking their head because we've all been there. So to have a core mission statement and your values of what the work is going to be, and the next piece is you have to have a facilitator. That doesn't mean the leader, it doesn't mean it's the mayor, it could be someone that's just invested in making it happen, that doesn't necessarily have a lot of chips in the game, per se. Sometimes a facilitator that doesn't is the best way to go. I would set up dates and a simple work plan, and that facilitator and that small core group, you hold each other accountable to move forward if you're invested in fixing what's going on. The other thing I'd like to tell you is don't reinvent the wheel. There's so many good models out there to do that we don't have to start. Many groups that you'll be on, there's a planning part of a grant, and it's a 6-month planning. Well, that's great if you can get it, but there's so much out there that usually you can hit the ground running fairly quickly. Call other cities, other schools. We've all done work. Everybody in here is your best probably example of what to do with each other. Ask. Invite people to come and talk about it. Bring in professionals that have already done what you're trying to do. Too many people have done good work in this community not to use what we have. I already talked about don't operate in silos. It's hard not to. We all have our own work that we have to do. We all have laws that we have to abide to. But I'm telling you, if the Family Justice Center can get around cops and attorneys and nonprofits who have their own, you guys can do anything. I already said pick a facilitator and be creative and open-minded. I think you really need to have the number one investment that we know we are on the verge of having some more horrific things happening with young people if we don't grab onto some of these things that we're talking about that need to be remediated. It's not getting better, it's getting worse. Families need support. And to do that, we have to be creative. That doesn't mean the typical therapy, that doesn't mean, and those are good tools, but I'm saying we have to be creative how we help parents and families, and we have to listen to the families. So when you pull those groups together, I would definitely bring in families that have either been helped by somebody, need help, or have ideas how to do that. Because what we think people need is not always the answer. And I will tell you at SAFE, and I remember when June and I first started working, someone comes in for services, I don't care who you are or what you do. They come to your office, you pretty much know what the problem is. We've been told a kid's been busted. He got caught smoking pot, so that's the problem, right? Well, when you're older and you've lived it a little bit, you know that's not the problem. That's the symptom. That's what's brought the family to our door. But that's what the parents want fixed, right? They want that kid to stop smoking pot. Well, okay, that's what we're going to do. We're going to help you with your young person, and he does have some issues. But because we know better, we know there's other issues out there. So you have to be able to say, what is it, Mom, that you need? We know Johnny's smoking pot, but what do you need? And that's where you start really getting into what the problems are, and that's how you start building about what kind of services you're going to do.
Melissa, take about 2 more minutes, okay?
I'm almost done. Oh, I couldn't have done it that good if I planned it. So the bottom line is, as community leaders, you have the ability to pull together really good groups and some people to start the conversation. with someone, somewhere. All the people you want are just a few. It doesn't take millions of people to get good stuff done. Kids need heroes in plain clothes every day. We have heroes that wear uniforms, we know that, but they need us. And we're the heroes that really need to step up. You've got the basis now, and I would really hope that you take this back to your communities and do some good stuff with it.
Thank you. Stay right there for a minute.
Okay.
Just a quick flashback. The Health and Safety Task Force, this task force started because a few days after, I think it was 4 or 5 days after the Sandy Hook shooting, Melissa contacted myself. I don't know if I was mayor at the time. I think I was. I don't remember.
I think you were.
And Mayor Rick Gibbs here out of Marietta. And Melissa said, we have to do something about it. And together we sat down, and here we are with everybody's participation. But I think it's appropriate that we come on down, Mayor Gibbs and I, or former Mayor Gibbs and former Mayor DeGuyer and I, come down and acknowledge your work.
You're in trouble.
I knew it.
Okay, you're really in trouble.
All of us here are here because we want to improve our communities. We've decided that we wanted to take a proactive position in our communities to bring forth change and to bring forth great communities. And that's exactly what Melissa did. She got us on the phone, and she's here and facilitated this whole program because she says not in our community. And her community is all of our communities. And so I just wanted to take a moment and read the presentation to Melissa. In genuine appreciation for your involvement and expertise, Melissa Donaldson, SAFE Executive Director, presented by the Regional Family Youth and Health Task Force. And below it has all of our venues: the city of Temecula, Murrieta, Canyon Lake, Hemet, Lake Elsinore, Paris, San Jacinto, and Wildemar. And then the school districts of Temecula Valley, Murrieta Valley, Menifee Union, Hemet, Lake Elsinore, Parish Union, San Jacinto, and Val Verde. Quite an impressive list, I must tell you. Thank you for everything you've done.
Thank you.
Rick?
The presentation that Melissa just gave kind of capsuled 9 months of effort. And the reality, as Mike alluded to, is this effort would not have happened at all if it hadn't been for Melissa Donaldson. When she said community leaders need to be involved, I put her at the top of the community leaders because she is the one who had the expertise, who had the persuasive ability to convince every one of us that we belonged here, that we should do something for our communities, and that it was possible to actually be productive and accomplish something. So God bless you. Thank you.
Thank you so much. Very, very much.
Well, we've reached the time of our last item on the agenda, and I think that would include closing remarks from each and every one of our task force members, and maybe a commitment as to where we go to from here. I'd like to just say a couple of things and lead that off. And that is, the city of Temecula took the liberty of compiling a resource guide, and everybody here has a copy of it. We certainly have our logo on it and kind of take ownership of it, but we'll make it available to your cities as well, absent that. You feel free to do what you would with this, put it on your websites or what have you. We'll gladly make this data available to you, but we've compiled all of the resource information here. Give it away, use it, don't let it get dusty. We're going to continue to update it as necessary, and also you help us update it. If you find that there are some resources that you come across, we actually have a vetting system that we used here, where if you recommend something, we'll actually go, we have staff members who will go check it out, make sure that it's a credible organization, and we'll put it in the resource guide. And so you guys will keep, all of us here will keep it dynamic. I also wanted to share with you something that we've done, and I think it was 2 meetings ago. after, who made the presentation? It was so compelling. It was right before the sex trafficking. I think it was Wayne Sakamoto. That's who it was. And he gave a presentation, and all of us here were saying, my gosh, what do we do? How do we, and I think this is a common thread, how do we get this into our communities? We've got all this information, and we're all public servants, and we want to affect good and protection in our communities, but how do, Mike Nagar can't go to every door, nor can you. How do we do it? And the talk of forming a local task force came up. And so Mayor Pro Tem Edwards and I, we put that on our council agenda, and our city council approved it in early December or late November. And no, it was actually a little earlier. And we sent out applications and had a tremendous response. And our criteria for our local task force was that we didn't want people who were connected in the community or people who were prominent. This wasn't about them. This was about working and getting out in the community to take this message out. And so we wanted a whole range of different participants, from youth to senior citizens to other people in the community that felt they had something to give. And we got about 40, 50 applications, and we had to vet them through. They were very good. And the council went ahead and appointed, I believe we appointed, was it 9 or 10? I think it was 10. Each council member chose 2 to be on it. And we actually kept it at 10 because we didn't want a group of 20. We didn't want a whole bunch of people doing nothing. We wanted a small group who would make the commitment. And we were very forthright about this. Don't join this group unless you're willing to work. And I know that we have some members of that task force here in the audience. Could you just stand real quick if you're on the task force? Okay. Thank you all for your commitment. And we coined a term at our council meeting on Tuesday, and we brought them all here, and they all kind of said what was on their heart. And then we coined a term, and it was get exponential. And that is, take this information out in the community and spread it. Spread it at HOA meetings, spread it at school venues, spread it wherever you can get yourself into, in whatever manner, spread it. And so that's what we're doing as a city. Did you want to add anything more to that, Mayor Edwards?
I think you're doing a great job, and I have every word you said right here on my computer, because I'm the scribe today. Mm-hmm. So I can't thank you all enough for following all the way through this program, and it's been very enlightening and in many cases disheartening. But the good news about that, it's given us some goals. It has given us some problems, and we are goal-oriented, so we needed to know what the problems were in order to set the goals, to solve those problems and take care of those issues. And Mike has just shared how the city of Temecula plans to move forward and deal with those issues. And I would say the plan we have is a fluid plan. And I think you have to be flexible in these situations, because as needs change, you have to be willing to adopt new methods and new remedies. And so we all know that we're willing to do that. We've enlisted the help of community members who are committed to improving our city and to taking the information and the remedies and the solutions and the resources to the public where it's needed. So for all the agencies that are involved, and of course SAFE is one of those, and I hope that Boys and Girls Club will be one of those, and Oak Grove, and the list is long. That's the blessing, is we have very many resources. We just need to let people know that those resources are available and to be able to direct them in the right direction. So I say hang on to your hats, because if the numbers are what we've heard, and I have no reason to believe that they aren't, sadly, I think we're going to see huge influxes into our organizations of kids looking for help and their families. So we're ready for that. So thank you all for being here and for participating. Melissa, you were absolutely irreplaceable in this process. So we're not experts. We think we are at some things, but we're not, especially in this area. And it does take someone who's been in the trenches, and you've definitely been in the trenches, and Dr. Doan and Rocky Hill and all of you that contributed to our education. And I know we asked some very elementary questions, and I think we're typical of what the population is, of what our residents are. So there are parents out there who don't have a clue what to do. So we need to help provide them with those resources, and that's what Temecula has decided to do in the form of this resource guide, and I'm sure other agencies have other solutions that will be conducive to healing and dealing with issues in their cities, so I'm anxious to hear about those too.
Mayor Edwards, thanks. Mr. Gibbs?
Ancient history. A long time ago, I had teenagers, and my wife had a phenomenal ability to talk to teenagers. And every afternoon after school, there'd be a dozen teenagers in our very large kitchen. And what I remembered is that when we'd have teenagers who'd never been there before, they would say the most amazing thing. I could never tell my parents that. Because at our kitchen table, the teenagers there talked about who was on drugs in high school and who was sleeping with who. They were comfortable enough with my wife to share that to her. The point I'm making here is that sometimes we try and make too complicated. Parents, talk to your children. I'd be interested in knowing, are there any priests, rabbis, imams, reverends in this audience today? Don't see one. One, thank you. I have no idea how many churches are in the southern part of Riverside County, but my guess is a lot. And what I would say to all of those folks who are church leaders, maybe at your Sunday sermon, a little less sometime on hellfire and brimstone, and just say to your congregation, talk to your children, hug your kids, because that's where it all starts.
Thank you, Councilmember Gibbs. Jerry,
Well,
go for it.
I just wanted to thank both of you for kind of putting this together, Melissa, all our presenters, they've been outstanding, and my feeling, kind of trying to sum it up, is we now have an awareness that's a powerful tool for us just to even have the conversations. And I think that's a great first step. And again, thank you to you and all your staff for this, because all this stuff can be very overwhelming, and to have a product at the end of this is very valuable. It gives us something to work from and to present and talk about. So thank you. And
you. There you go.
Oh, there
You're
it
shutting
goes.
down.
I turned off the wrong thing. Just thank everybody for this whole process. I hadn't even thought about it, and then I was invited to come, and it's been very enlightening to me. The Dr. Doan with his virtual gaming addictions I found very interesting. Also, listening to that, my district has decided to make sure every student in our district has a computer, and we've been checking them out to them, and your talk kind of made me very concerned, and so we've been trying to enlighten the parents about possibilities, and we've had training for our parents to come in and kind of things to look for and some ground rules for their students. And I appreciate your input on, we thought about, and we're trying there, although we're probably outnumbered by students out there in our computers. But the training of the parents is something that I find important to this whole process, is it enlighten them to the dangers that are out there about their parents. And we're working with them, and hopefully it will help us in the end. Thank you.
Thank you. John?
I'd just like to reiterate what my colleagues are saying here. It was very, very enlightening to come to these sessions, and the preparation of all of our speakers and the presenters was just very dynamic people. And with our changing communities, the way that we have grown, or will continue to grow, we need to get ahead of a lot of this stuff and to plan backwards. And people like Melissa there who have done this for many, many years and successfully put together groups and organizations that are able to tackle these kinds of issues and problems. I think this is one of those things that we continually will need to change, update, and kind of morph ourselves as our communities are growing as well. But thank you for inviting us. San Jacinto Unified, I believe, is trying to get ahead of the curve on a lot of this stuff. And we have some very, very good programs in place that address many of these problems and issues. And we work very closely with the city. And I'm sorry that Crystal Ruiz had to leave to go to another meeting. But that's one of the things that I think is highly important. And I see it here with a lot of the leaders is that there is a connection and a working relationship from the school district and the cities. And it's a very healthy thing to see, and it's a very healthy thing to have. And I got to say, Rocky, he was one of my heroes about, well, he said it was a long time ago, 1988. So, darn, I'm dating myself too. But Rocky was very, very instrumental in helping me start a program at Mount San Jacinto College. And he probably doesn't remember, but I got to hear his story back then, and I was very compelled by it. But thank you, Rocky, and it was a pleasure to hear you again.
More hair then, didn't I?
Thank you. Yeah. I'll join that group. Michael.
Again, like everybody else is saying, thank you to everybody, Dr. Doan, Melissa, Rocky. You guys, you have enough work as it is, as we all do, and yet we're still here. I want to really thank the Twin Cities for inviting Valverde Unified School District. This was an awesome task force. The work that's put into this guidebook is tremendous. Thank the staff for doing that. And I look forward to future task force so we can work together.
Thank you. Bridget.
Also, thank you. I do feel like I have a lot of homework to do now. I do like your idea of the task force. I do think that's something we can do. I will not mention the money, but I think we can brainstorm, and that's something we can follow. And I'll be calling Betsy. Thank you.
Thank you. Steve?
Thank you, Mike. These meetings have been incredibly informative, sometimes painful to listen to, and always thought-provocative. Between the drug addiction, alcohol dependence, prostitution, human trafficking, spousal abuse, and even the internet addiction, I learned a lot. And I think these are a lot of things that we don't think about on a regular basis. And the other thing we don't think about is how these challenges in our community are ever present. It's like the tide. It's going to always be there. We're always going to have to work to reduce the effects of this on society from here on forward. And the question I've always asked every speaker that's come across is, what can we do as elected officials to fight the tide? What can we do? And we've had some great responses, and I've been taking notes of everything that's been said. And I have to say that we're going to be working as a city, and we're going to be working with our partners as a city. We're going to go ahead and make things happen. We're going to go ahead and put together the programs that we're talking about. And you put the playbook together. And I can't say how much I appreciate that. I want to thank the cities of Temecula and Marietta, express our extreme gratitude for this. These meetings have worked towards the end that I think that you intended. We're talking about this. And that's the biggest thing I've gotten from this was the communication. You have to know where to go. You have to know where to grab those resources. You have to be able to recognize the red flags. We have to be able to go and have the strength of character to be able to reach out to those people who need help and know where to find them help. And so I look forward to playing a part in that. Again, Mike, thank you for putting this together. Rick, you guys did a wonderful job hosting us in your homes. This is wonderful, and thank you so much.
Thank you, Steve. Julio.
Well, thank you, everybody up here, and I think there's a lot of us missing this last meeting, so thank you to them, and thank you Temecula and Marietta especially for hosting us. And maybe if we continue this, we can move around up and down the 215 and the 15 to the rest of our cities.
Absolutely.
And school districts. I think one of the things that we always, because we're on city councils and school boards, we're always talking about money, and I'm glad that you made that point, because if we really want to prioritize something and if we really actually care, there's no excuse and there's no dollar amount that should stop us. And so that's, I think, where we should all start, and that's what when I go back and talk to Councilwoman Rogers and the my three colleagues on the City Council in Paris, is this a priority? And if it is, then how are we going to make it, have it done? And maybe it's my age, but I get really impatient, and I want to get things done, and I want to get moving on things that are important to me and important to the community. So I hope that in moving forward with this task force, we actually, even the several of us sitting up here, that we also start working and we start doing a little bit more, because like you said, we need heroes, and I think a lot of us are very active in our communities, and a lot of people see us, and so if we're talking about these issues and not pretending that they're not there, something's going to happen. And lastly, because I think we are so independent of each other, because we compete for what store is going to come into our town, and we compete for the sales tax. But I think for these issues that are not of contention, we need to work together, and we need to figure it out, because as a region, we need to come up, and we need to do it together. And so while we come from different political thinkings, I think we all just believe that regionally we need to start setting ourselves up and stop being second fiddle to LA or San Diego, and take our righteous place. So thank you, everybody, and thank you so much.
Thank you, Julio. Tim?
I'd like to thank folks from Temecula and Murrieta for putting this together. I think it's been very informative. The panel speakers have done a great job of telling me things that I didn't know and provoking me to think more about issues. And I'm very grateful for that. That being said, maybe I'm going to put a little bit of a downer on all of this. I'm walking away a little disappointed, too. When I go out there and I see a 13-year-old smoking a cigarette, I still don't know what to do. I don't know. When I see a guy out there asking for a buck on the corner, do I give him the buck, a homeless guy, or do I just drive on by? I mean, those kind of daily dilemmas, after 60-some years, I'm still trying to resolve. And I would hope that this group might be able to do more, try to get to the heart of more issues, get to the moral center ground that each of us struggles with day in and day out, to find, what it is that makes each of us care about other people, and what we might do to make our lives better and fulfill our dreams of being good people. I think that compassion is with the individual. I don't think there's anything that us could do, maybe pass a few laws, but I think it's individual hearts that come into play, and how well we treat our fellow man. And I think maybe we can explore those avenues a little more. Another little thing I'm disappointed in, and small but big in my mind, there's no discussion of Celebrate Recovery, which I think has been one of the most outstanding programs that we have, that done more for people with troubles than anything else that I've ever seen work. And I'm just disappointed that we don't have people celebrate recovery. So I just wanted to throw that out there, and I would hope that we continue these discussions and try to look at more issues, possibly come up with legislative recommendations, and try to continue to help us on our path to being better people and more socially conscious. So thank you again, and I hope this continues.
Well, let me ask the panel, and thank you, Tim. Is there a will to meet again? And if so, when?
For what purpose?
And for what purpose? I'll throw some things out there for discussion. Tim, you stimulated some thought. I don't think this is not meant to be once in and we're out. I think this is a very dynamic process. Maybe we get together in the next 8 or 9 months, and everybody come back and report on what we've all done in our respective communities.
I would like that.
And not necessarily what Mike Nagar has done, or what Steve has done, or what Julio himself has done, but the goal is to get exponential. So I'm kind of curious what we've all done, what's occurring in our communities that we can glean from. I'd really love to know what's going on in Wildemar. What do the people of Wildemar do that maybe we can copy? You know, that's sort of the thing. Any other comment or thought regarding that?
That's an excellent idea.
Yeah, I like it.
I just think that might be too long of a time to wait for that long. Maybe. Yeah.
What?
I mean, as Tim said, I mean, there's a whole lot of issues still to keep on talking about, and if everybody agrees to, I would ideally see this to be a quarterly meeting.
That's okay by me. You okay with that?
We could, and what could take place is you could go home after this meeting and propose to your councils and your other collaborative agencies that you do basically the same thing that we've done on this panel, and that is to bring everybody to the table to decide exactly what Melissa said. I mean, she laid the plan out for us perfectly. Decide what the issues are, put together a group of people. I mean, you may just want to do that and come back and tell us what you've learned in your communities.
I would suggest, too, that you spread the responsibility of identifying speakers around to the different groups and different communities. Don't take on the whole load yourselves, but allow this to continue without the workload.
And venues. Julio, you wanna host it in Paris? You're on. Okay.
Mm-hmm.
Yeah, you're. Yeah. Quarterly. Is everybody okay with quarterly? And then of course we can all keep in touch. Betsy could be sort of like the hub of the wheel and make sure we're staying dynamic and fluid.
I also think another thing that's really helpful is to hear anecdotes or true stories about incidents that have happened in your community and how your community dealt with it, what resources were called into action, and what the results were. And sadly, it may be as the result of a tragedy and what happened afterwards, so that you could deal with the aftermath in dealing with students, or to take preventative measures so that those things didn't happen again. Or it could be, a mass arrest or drug bust or expulsions or any types of situations like that. I would like to hear anecdotal situations of what happened and how you dealt with it, because we can all apply those things to our cities in those cases. So
I'm inspired. I'm kind of an idealist. I sit here and I'm seeing, my gosh, the cities are talking. And everybody is going to take that into their community. Their communities are talking. I mean, to me, it just blows me away. Murrieta's talking, San Jacinto's talking, and I'm including all the school boards as well. Canyon Lake's talking, Paris is talking, Elsinore's talking. You know, I'm excited. We're doing something collaborative that just, I just don't know if it's being done in the nation. And I'm really impressed that everybody wants to keep it going. That's pretty cool.
That's the key word, in my opinion. I've said it before in other meetings that we've had. It's the bottom line. It's a collaboration of everybody, and if we mean well and we learn some tools. And I think the quarterly message would be is just exactly like Mayor Edwards said. You know, we've got the basic tools here where we can go back to our agencies and deal with. Come back every 3 months. Well, this is what we are doing, or this person is doing this, so we learn from each other, because what you're doing next door, I may not even know about. What a great idea.
Well, Betsy, it looks like we're on quarterly. Anybody else have any other comments or questions? Anything you guys want to insert?
Proud to serve. Let's go.
I don't see it. One last thing, one last cleanup item, and I saved it for last, is, and I don't want to brag too much, but about Betsy Lowry, because then you all want to recruit her, okay?
You can't have her, so
You can't
don't even
have
think
her.
about it.
All right, but Betsy, thank you for all of, you know what, couldn't be done without you. Okay. I'm going to finish this up with something that I'll speak mutually, I believe, for everybody here. I have a tremendous respect for all of you here on this dais, and a tremendous respect for all of your cities and your organizations. Southwest Riverside County is probably one of the premier regions to live in the nation. No, it's not probably, it is one of the premier regions, and we serve a great community, all of us do. And I just want to thank everybody for being here. And with that...
Thank you.
Oh, yeah. Did I miss something? Oh, I have a public speaker. Okay, now you see, I finished on a
high
yeah,
note.
on a high
There you
note.
go.
Okay, we do have one public speaker, and that's the Unplugged Challenge. Yeah, Dr. Doan, come on up.
Actually, may I introduce the Michelle and James?
Yes, you can.
Okay, so Michelle and James approached me after reading my book and knowing what I did about video game addiction. And so they actually have a program that actually solves your money problem and also how to reach the kids. So they helped a city in Utah help the kids unplugged by handing out these little badges, like merit badges, and they were able to connect the businesses with the children with the information and training for the parents. In the meantime, raising money for the city without any additional cost for the city. So I'll let them come up and take it from here. But I want to emphasize that it's important to unplug these kids from digital devices because, as you recall from my talk, in Greece, a peer-reviewed research study showed that kids who overuse the internet and video games becomes a gateway entry into drug abuse. Because people who basically develop that dopamine rush in one column, they tend to switch their drug of choice or behavior to other drugs and behaviors that stimulates the same dopamine pathways. So really, we have to address this issue from the very beginning with the digital addictions, which runs 1 in 11 kids. So for a town of Temecula with 100,000 kids, you're talking about 3,000 kids who are now prone to future drug and alcohol addiction in their future. So from here, I'm going to introduce James.
Thanks, Dr. Doan. Wow, you guys. Mike, I can answer specifically to you. You talk about what you're doing and breaking ground, new ground, and leading the rest of the country. We're invited to come and speak to communities and city council members all over the country. And, you know, I spend the majority of my time trying to bring people up to speed on what the real challenge is, what the dangers are, and the reality is we're losing our kids. I'm 50 years old. I have 5 children. 2 that are married, 1 on a mission in Brazil, and twins, 8 years old. You know, we have been blessed, and we see a real need. I look at the task force and I see what you got, the topics of what you've already addressed, and these are just tremendous issues that for a lot of communities are going unnoticed, under the radar. They're not recognizing what a challenge this is, and how devastating it is to families, and how it's destroying families, and it's destroying youth, and it's destroying the kids. And so, you know, we're a nonprofit organization that has built a community program. Money's always an issue, and that's why this is such a great program. It doesn't cost the city anything. It's a collaboration effort between city leaders, local businesses, and families themselves. And we create a vehicle and a platform where you're able to take all this information that you've simulated over the last however many months you've been working on this and get it down to the parents where it's needed. I mean, we can talk about this, but until we can get parents to come forward and say, hey, I'm having challenges, you know. My kid's walking across a crosswalk staring at his phone. I try and have breakfast in the morning and they're just texting. You know, from pornography issues to texting and driving to obesity issues, it all stems from screen addiction. And, you know, we read Dr. Doan's book, and it's amazing because it shows that it reprograms the brain, and that's what we're allowing every single day, that we don't find a happy medium and a balance for our kids and what they are seeing.
So take the next 3 minutes and tell us about your program.
The program basically is a summer program, and it's been very, very effective. Essentially, we go around and we get 101 businesses to sponsor 101 outdoor activities. You know, there's so many activities to be done right around this area. So each business sponsors a specific activity, and they have these tags then that come with their business name on them. The kids are introduced to the entire program the last 2 weeks of summer, where you go and have a kickoff assembly. Somebody from your task force or whatever else. You go to the school, we give every one of the children a lanyard, a tag, and we explain to the children that the way the program works, kids, you're going to have a great summer. You're not going to be sitting at home wondering what to do this summer, because there's an activity book with 101 activities in it, and the businesses that are sponsoring each one of those activities. The kids go and perform the activity. They go to the business. They take mom and dad with them. They walk into that business. Now, the businessman loves this. They sponsored an activity. It cost them $250. It was nothing, okay? And that gave them all the tags and everything else that comes with their sponsorship. A lot of publicity they're going to get as well. The kid goes in there, mom and dad in tow. They get their tag. They register that tag because it's worth points. Those points then are calculated every single week, and there's a drawing. There's a drawing at the high school, middle school, and elementary school level. And they're winning cash prizes every single week. And all the kids see who's winning the prizes. So it creates more and more excitement. It's designed to get the kids outside. It's designed to give parents a roadmap for something fun to do this summer, because as a parent, sometimes it's hard to, what to do. Well, there's millions of things to do, but now the kids are going through this book, they're seeing it. The book's available at every single sponsor's business. It's available at city offices everywhere. So the kids go and do this. They go out and they enter, they do the activities, they get the tags, and then they go redeem the tags for points that are redeemed then for cash prizes throughout the summer. It's all supported by the local sponsors. $250 is nothing. They're going to get 500, minimum of 500 parents walking through their front doors, not like advertising on a billboard and hoping somebody's going to come see me, or doing something on the news or a magazine or whatever else. This is going to put customers directly in the front door of those businesses that are helping to sponsor.
Okay, I'm going to cut you off there only because I have to be respectful of the panel's time. Does anybody have any questions of the speaker? Okay, you've given us some good information. It's in our hands, and in fact, it looks pretty interesting to me. Let's see where it goes.
Can we just tell you that to see more information about this, you can go to unpluggedchallenge.com.
And if you feel inclined, you want to contact each of the panel members, Ms. Lowry will get you a list of the members.
Fabulous. Thank you, Mike.
Thank you for being here.
Likewise, if any of you would like us to come to your respective cities to the council and explain the program further in more time, we'd be happy to do that.
And anyone on the panel that would like to come up and get what we can to them while it lasts, you're welcome to come get it.
Very good. Thank you.
Thank you.
Panel members, Godspeed to you all. Thanks for being here. We are adjourned.